Did you know that there are early warning signs for dementia? This is our topic for today's video. Understanding the early warning signs of dementia is essential for early detection and intervention. What is dementia? Dementia is not a single disease, but a term used to describe a decline in cognitive function severe enough to interfere with daily life. It is often associated with memory loss, but it also impacts other cognitive abilities such as reasoning, judgment, and language. Dementia is caused by damage to brain cells, affecting communication between them and disrupting normal brain function. What are the types of dementia? There are several types of dementia, each with its unique characteristics and underlying causes. Alzheimer's disease is the most common form of dementia, accounting for approximately 60 to 80% of cases. Other types include vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia, which involves a combination of different types. What are the causes of dementia? Dementia can be caused by a variety of factors, each affecting the brain in different ways and leading to cognitive impairment. Understanding the underlying causes of dementia is essential for early detection, accurate diagnosis, and targeted treatment strategies to help manage symptoms and improve quality of life for affected individuals. The causes of dementia vary depending on the type. We will discuss them in more detail right next. Alzheimer's disease. One of the primary causes of dementia is Alzheimer's disease, accounting for the majority of cases. Alzheimer's disease is characterized by the accumulation of abnormal proteins in the brain, namely beta-amyloid plaques and tau tangles. These protein aggregates interfere with communication between brain cells, leading to their dysfunction and eventual death. As brain cells are lost, cognitive abilities such as memory, reasoning, and language deteriorate, ultimately resulting in dementia. Vascular dementia is another common cause of dementia, often resulting from conditions that affect blood flow to the brain. This includes conditions such as stroke, where a sudden interruption of blood flow deprives brain cells of oxygen and nutrients, leading to cell death and cognitive impairment. Other vascular factors such as small vessel disease and hypertension can also contribute to the development of vascular dementia by causing damage to blood vessels in the brain over time. Lewy body dementia. Lewy body dementia is characterized by the presence of abnormal protein deposits called Lewy bodies in the brain. These deposits disrupt normal brain function, leading to cognitive decline, visual hallucinations, and motor symptoms similar to those seen in Parkinson's disease. The exact cause of Lewy body dementia is not fully understood, but it is believed to involve a combination of genetic, environmental, and lifestyle factors like poor diet and physical activity. Frontotemporal dementia. Frontotemporal dementia is a less common form of dementia that primarily affects the frontal and temporal lobes of the brain. This type of dementia is characterized by changes in personality, behavior, and language, rather than memory loss. Frontotemporal dementia can be caused by genetic mutations or the accumulation of abnormal proteins in the brain, leading to the degeneration of brain cells in affected regions. Mixed dementia. In some cases, dementia may result from a combination of different factors, known as mixed dementia. For example, a person may have both Alzheimer's disease and vascular dementia, leading to a more complex presentation of symptoms. Mixed dementia is often more challenging to diagnose and manage due to the overlapping features of multiple underlying causes. Other causes of dementia. While Alzheimer's disease, vascular factors, Lewy body dementia, and frontotemporal dementia are among the most common causes of dementia, other factors can also contribute to cognitive decline. These include traumatic brain injury, chronic alcohol abuse, metabolic disorders, infections, and certain medications. Identifying and addressing these underlying factors is crucial for accurate diagnosis and appropriate management of dementia. What are the 6 early signs and symptoms of dementia? Recognizing the early signs of dementia is crucial for early intervention. This is a progressive condition that often begins with subtle changes in cognitive function. Recognizing these early signs and symptoms is crucial for early detection and intervention. While the presentation of dementia can vary depending on the underlying cause and individual factors, there are some common warning signs to watch out for, like memory loss. Memory loss is one of the hallmark symptoms of dementia, particularly in the early stages. This may involve forgetting recent events, appointments, or conversations, and relying more on memory aids such as notes or reminders. While occasional forgetfulness is normal, persistent and worsening memory loss could indicate a more serious underlying issue. Difficulty completing familiar tasks. People with early-stage dementia may struggle to complete familiar tasks that were once routine and effortless. This could include difficulties with tasks such as cooking, managing finances, or following familiar routes while driving. Changes in the ability to plan, organize, and execute tasks may become apparent to family members and caregivers. Confusion about time or place. Individuals with dementia may become disoriented and confused about time or place. They may lose track of dates, seasons, or the passage of time, leading to confusion about where they are or how they got there. This can be distressing for both the individual and their loved ones, especially if they become lost or disoriented in familiar surroundings. Trouble understanding. Visual images and spatial relationships. Some forms of dementia, such as Alzheimer's disease, can affect visual perception and spatial awareness. Individuals may have difficulty judging distances, navigating spatial environments, or interpreting visual information such as maps or diagrams. This can manifest as bumps or falls, difficulty reading or driving, or challenges with activities that require hand-eye coordination. Problems with language. Language difficulties are common in dementia, particularly as the condition progresses. Early signs may include trouble finding the right words, repeating the same phrases or questions, or struggling to follow or participate in conversations. Changes in language abilities can impact communication and social interaction, leading to frustration and isolation. Changes in mood or personality. Changes in mood, personality, and behavior are often early indicators of dementia. Individuals may experience uncharacteristic mood swings, irritability, or apathy. They may withdraw from social activities, lose interest in hobbies or activities they once enjoyed, or exhibit changes in personality traits, such as becoming more passive or aggressive. What population is at risk? While dementia can affect anyone, certain factors increase the risk. Age is the most significant risk factor, with the prevalence of dementia increasing with age. Family history of dementia, genetics, cardiovascular risk factors, such as high blood pressure and diabetes, smoking, and sedentary lifestyle also contribute to the risk. How to prevent dementia? While there is no absolute way to prevent dementia, certain lifestyle modifications can help to reduce the risk. Maintaining a healthy food plan, rich in high-quality proteins, low-sugar fruits, vegetables, and omega-3 fatty acids, staying physically active, engaging in mentally stimulating activities, maintaining social connections, and managing cardiovascular risk factors can all contribute to brain health. Diagnosis and treatment. Diagnosing dementia involves a thorough medical evaluation, including a review of medical history, physical examination, cognitive tests, and sometimes brain imaging studies. While there is no cure for dementia, early diagnosis and intervention can help manage symptoms and improve quality of life. Treatment may include medications to manage symptoms, lifestyle modifications, and support from healthcare professionals and caregivers. Dementia caregiving. Caring for someone with dementia can be challenging, both emotionally and physically. It's essential for caregivers to prioritize self-care, seek support from family and friends, and access resources and services available in their community. Education about dementia, effective communication strategies, and creating a safe and supportive environment are crucial aspects of caregiving. In conclusion, and to summarize today's video, dementia, a term encompassing a decline in cognitive function, presents a formidable challenge for individuals and families alike. It's not just about memory loss. It affects reasoning, judgment, and language, disrupting daily life. This neurological condition arises from damage to brain cells, hindering communication between them and impairing normal brain function. Dementia manifests in several forms, each distinct in its characteristics and root causes. Alzheimer's disease, the most prevalent type, constitutes the majority of cases, followed by vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia, which is a blend of different types. Understanding the causes of dementia is vital for early detection and targeted interventions. Alzheimer's disease, marked by abnormal protein buildup in the brain, leads to cellular dysfunction and cognitive decline. Vascular factors, including stroke, disrupt blood flow to the brain, while Lewy body dementia involves abnormal protein deposits. Frontotemporal dementia affects personality and behavior due to brain cell degeneration. Additional causes of dementia encompass traumatic brain injury, chronic alcohol abuse, metabolic disorders, infections, and certain medications. Identifying these factors is pivotal for accurate diagnosis and tailored management. Recognizing early signs of dementia, such as memory loss, difficulty with familiar tasks, confusion about time or place, visual perception issues, language difficulties, and mood or personality changes is crucial for timely intervention. Risk factors include age, which remains the predominant risk factor, with genetics, cardiovascular health, smoking, and sedentary lifestyle influencing susceptibility. Comprising a healthy food plan, physical activity, mental stimulation, social engagement, and managing cardiovascular risk factors can mitigate risks. The diagnosing dementia involves comprehensive medical assessments, enabling early intervention and symptom management. While treatment doesn't offer a cure, it can enhance quality of life. Caregiving for dementia patients necessitates self-care, support networks, and access to educational resources and services. In essence, understanding dementia comprehensively from its diverse forms and root causes to early signs, preventive measures, and caregiving strategies is paramount. By equipping ourselves with knowledge and support, we can navigate this complex landscape with greater resilience and compassion. Thank you for tuning in to Levitas. If you found this video helpful and informative, be sure to share it with your friends and family. Give it a thumbs up, subscribe to our channel, and hit the bell icon to receive notifications for future videos on weight loss, health, and fitness content. Also, leave a comment sharing your questions, thoughts, and experiences with today's subject. We love hearing from you. Your support is very appreciated. It helps us grow and create even more content for empowering you to achieve a better body and optimal health every week. Remember to fuel your body with the right nutrients. Stay consistent with your training and keep striving for your fitness goals. Until next time, remain tuned to Levitas for more expert advice to help you on your health and fitness journey. So stay healthy, stay happy, and keep going.